Hi, I'm Dr. Stephen Brookenthal, lead veterinarian at the Glendale Clinic, and this is how I get ready for an appointment using the new AI-assisted patient overview. So I always start my day here at the Modern Animal Scheduler. This gives me an overview of my day, all of the cases I'm going to see today, and today we're going to focus on Jinkies. Jinkies is an almost 20-year-old cat who is here, according to this, for a wellness visit. Let's go into her chart. And over here on the left side is our new patient overview. This is essential to my day. Let's take a peek. The first thing that we see in the overview is, well, our patient's name, Jinkies, and probably my favorite part of this feature is my history. This says I've seen the pet 3 times. The most recent time was on June 24th for a wellness visit. This saves me from walking into a room and saying, "Oh, hi, Christy, it's so nice to meet you," when I've known Christy for 3 years. This is a bit of magic that is created from the entire years-long history of this patient's time with us at Modern Animal. So it's looking at all the medications we prescribe for the patient. It's looking at all of the appointments that we've seen, whether they've seen a doctor or a technician. It's looking at our notes on the patient's anxiety in the clinic. It is a magical tool, and I'll read through it a little bit with you. It says Jinkies is a 19-year-old spayed female domestic short hair cat. Her last known weight was about 11 pounds, which was a slight decrease from when we saw her earlier in the same month. It goes through her diet and some recent concerns that the client had about Jinkies. We don't have to go in a deep dive through her record. We have all of the highlights right here. The medical history highlight is essential also. This is going through all of her diagnoses that we've given her over the past many years that we've seen her. And Jinkies, as she's here for a wellness exam and is 20 years old, has a bit of an interesting medical history. In this case, she has a history of chronic kidney disease, IRIS stage 3. She has systemic hypertension, hyperphosphatemia, and pancreatitis. Had I not looked at this before this patient walked in, and had I not had the history of Jinkies that I do, this would have been quite a surprise walking into the room. I would have had tons of records to go through. So this gives me a great place to start, especially if I've never met Jinkies already. So that's how I like to spend my time with Claude before going into an appointment. Claude has tons of other features as well, and we've got more demos to show you too.